It is well documented that those of us with childhood trauma are much more likely to have a lifetime of chronic illnesses as adults. Everything from autoimmune disease, IBS, cancer, diabetes, heart disease, even pregnancy issues and loss and early maternal death. All kinds of issues really do relate to what happens to our bodies mentally and physically and emotionally as a result of childhood trauma. And that is especially true around what I've called often what we have a secret chronic illness that we don't take care of, that we don't talk about, that we struggle with. And I think that for so many of us, we've learned to ignore what was happening in our bodies in childhood, that disintegration, the lack of integration between what we felt in our minds and what was happening in our nervous systems, that we often, and our lack of self-care because of hypervigilance or compulsive caretaking or things like that, or our own depression, like collapsing and freezing in terms of trauma responses, that we don't necessarily know that we are suffering physically until it's way late in the game. And so we're having that back pain for too long, or we're having fatigue that we know doesn't seem right. But oftentimes these things slowly creep up on us. And so we just learn to live alongside them in discomfort. And this can be a huge part of living with chronic trauma and chronic complex PTSD is just not feeling well in your body. So what can you do? I'm a licensed psychologist. I'm so glad you're here. And we're going to talk a little bit about some things you can do today. So the first thing is how do you care for yourself? Do you care for yourself? Like really being honest about how you take care of the doctor's appointments, the dentist appointments, your exercise, your rest, your sleep, your diet. Like all these things are so important. And I think that we don't, for me in therapy, I think it's incredibly important to check in. Like, how are you sleeping? How are you eating? Because we know that, for example, sleep is one of the biggest issues that contributes to mental health issues. But if you're not talking about those things, then you're missing some really important information for yourself first and foremost, and frankly, so is your therapist. So you want to talk about, sometimes you have to focus on those things first before you can even get to the other things, because those are the foundation of functioning, even getting a shot at functioning well. So how do you care for yourself or not? Asking yourself, am I repeating patterns of neglect in my own childhood? Those old messages where I didn't get the foods I wanted or needed, or the care or the emotional care, and then to write down new ones, to write down new messages in terms of what are the patterns and ideas that I am worthy of and want to set as my standards for myself in terms of how I take care of myself. The next one is, what can I do? So like, for example, I've always had chronic fatigue, and it got really bad as I was approaching my menopausal state, and I wasn't sleeping, I was having insomnia, and I just kept neglecting it, and I had a few blood panels come back and say that I had a high ANA for autoimmune, and I didn't follow through with it because I was so busy working, and it just got worse until I was finally diagnosed. And even something like that isn't necessarily a quick fix to treat. It's a multitude of issues, your lifestyle, your sleep, medications, things like that. And so, but I could have done something different if I had it in my mind that it was a priority. I would have followed through earlier, right? And so, and it can take many, many years, just for example, with autoimmune, just to even get diagnosed because of the way the whole thing works. So the point is, what can you do? Maybe you're having palpitations in your heart and you're saying, oh, it's stress, it's coffee. But maybe it's not that. I can make an appointment. And I know healthcare is also luxury. So I also know this isn't always an option for everyone, but whatever it is you can do to try to find ways to get some support and assessment. And if you don't like the doctors you see, trying to find other ones, like all of that, I know all of those can be barriers. You can have your symptoms minimized and not be taken seriously. You can be told, I've seen women in menopause be like, oh, you just need, antidepressants. It's like, no, you're actually menopause, and maybe you need that, but it's so much more than that. So I know it's also a battle. It's not so simple as what can you do, but beginning to think about that you are the only one that can do something. The next thing is, it's not okay to feel bad. It's just because you're used to feeling bad, that's your standard. We don't want it to become our norm. And for so many of us, just functioning and pushing through pain or discomfort or sadness or whatever it is part of how we were, wired in childhood. And so it makes it even harder. So to just, first of all, start with, no, it's not okay. It's not the goal. You may have to deal with chronic issues, but it isn't just like, well, I'm not going to bother even getting that assessed because I'm used to feeling bad. So you really want to honor like what role that's playing about just your being accustomed to feeling bad inside, physically, mentally, and emotionally. This is all true for mental health as well. You want to give yourself, once again, self-grace and compassion, because some days we can push and some days we can't. And for someone like me, for example, that's a tough one with, always thinking I can fix things and work on things and all of that. So like, that's an important message to look at, that some days it's okay to do nothing and watch TV. And I struggle with this one, but it is important. And then to find ways to stop shaming your body. Oftentimes we kind of separate ourselves from the parts of our body. Oh, I hate this part of myself, or whatever it is, or my mental health. So to really work on that negative energy you're giving to yourself, and try to find more ways to embrace and love on who you are. And this is a whole other, probably, that's a whole other textbook, but it's important. And lastly, to try to find, which I know it's, like, oh God, really, but the research does show that trying to find gratitude can be incredibly helpful. And I think sometimes just specific gratitude for the day. Like, I'm just grateful for today that it's sunny outside, which actually it's not, but it was yesterday. I'm grateful that I had a breakfast I enjoyed. I'm grateful for my children being healthy today. It can be big things and little things, but it really does help, because we're so wired for negativity with our bodies, for example, to say, okay, I'm struggling with my autoimmune, but I am grateful that I have other parts of my life that are healthy that I could be facing much worse. And I'm going to try to take care of that today, things like that. And that goes back to that core of inner child, inner parenting work, which really, really is about, you are the only parent you will ever have. There will never be someone come along and reparent you. And even if though your partner can be a good co-parent in some ways, like, oh, go take your medicine or get to bed early, you have to realize that you are the only one that can do that now. And so it really is up to you. That no one is going to force you to go to the doctor or take your medicines or do the things. It's up to you. And that can be really difficult to do for 5,000 different reasons, from trauma to ADHD to other disorders like depression and anxiety. Right? It's not so simple. So once again, it is an ongoing thing you want to work on, but the more it's on your radar, I think the more likely you are to begin to acknowledge that you are worthy of feeling well, and at least trying to get the support that you need, and giving yourself the compassion and grace on the days when you can't or won't or aren't able to follow through, but to kind of set yourself up for the next day to try to move forward and lovingly parent and try to give yourself that encouragement and love. So that's it for today. Thank you so much for being here. Please consider subscribing, and I would love to see you on TikTok, if there still is TikTok at this point of this video. We'll see. But once again, thank you for being here. I really appreciate you, and I'll see you soon. Take care. Bye.